Some of you watching this video or listening to this audio may very well have heard about the Webster Technique, especially if you've been to a chiropractor and you've been to a chiropractor while you were pregnant. So today we're going to talk a little bit about what this technique is and what it really is not. I'm Dr. Rodney White with Sapi Chiropractic, and thanks for joining us. So the goal of a chiropractic adjustment is to restore normal mechanical and neurological function of the spine and joints and nervous system. The Webster Technique is a specific technique some chiropractors are trained in, like myself and all of our doctors at Sapi Chiropractic, that's specifically designed to help restore normal function and nerve supply to the pelvis and the sacrum, being the tailbone. Now, because when you restore normal function to the pelvis, some amazing things can happen, there's been some claims made about the Webster Technique, and we want to make sure we get those right for you. So if your pelvis isn't functioning properly during pregnancy, especially late stages, a lot of the ligaments that support the uterus as it grows, the round ligament that sits underneath it and wraps around the side wall, that attaches to the front of the sacrum, which is our tailbone. So if there's some kind of irritation that's causing tension and tightness around the pelvis and sacrum, that can cause tension and tightness and pulling on those ligaments. Now imagine the baby as they're getting bigger inside the womb, when they're getting ready to flip and go head down, or they're moving all around the place, if there's a lot of tension in a wall, it certainly makes sense that they may be able to get stuck there. And this could be why a lot of breech positions then tend to happen. So as a chiropractor, if we can get normal function back into that pelvis and sacrum, it then makes sense that that might let go some of that tension and baby might be able to move again. But again, this is what's led to a lot of incorrect claims made about this. And we'll get to that in a second. There has been some very small studies done, and very small, not big enough to make any kind of claim like this yet, but in these small studies, they found that there was up to a 90% positive result in a mother presenting with a breech baby, getting adjusted using the Webster Technique, and then baby turning. And we've seen a lot of those good results ourselves. But again, these studies aren't big enough to make any of those claims. But why would this potentially be happening? Well, chiropractors don't turn babies. We don't treat conditions. That's what the medical world does, and they do very, very well. What chiropractors do, like we said at the start of this video, is we restore normal function and mechanics to the nervous system and the spine and pelvis. When a body is functioning normally, amazing things can happen, but it doesn't always mean they will, because there can be so many other factors at play. Let's take, for example, what we've been seeing in a lot of the research with colicky babies. A lot of colicky babies seem to respond very well to chiropractic. But if that baby has colic and reflux because of some kind of pathology, chiropractic can't help that. We need to deal with the issue at hand, and that's where the medical world steps in very well. So again, if there's a breech baby that needs turning, we leave that to our very specialized OBGYNs to do that. But before having to go to that step, if you get assessed and find out that your pelvis isn't functioning properly, and then getting adjusted helps that to function more normally, and that then leads to the baby turning, and you don't have to go and have any kind of procedure done, or maybe avoid a C-section, then that's obviously ideal. Now, the second reason that we're wrong when chiropractors do say that Webster Technique is a breech turning technique, well, number one, we're not turning anything, but number two, the studies that have been done, like we said before, are just far too small at this point. We are getting bigger studies coming along, but they take time and money, and they've got to be set up properly. But until that happens, the take-home message has to be this. If a pregnant mother is concerned about breech or any other issue that could involve faulty mechanics or function of their body throughout pregnancy or later on, whether it's back pain, some kind of pelvic floor muscle issue with urinary incontinence, whether it's breech, any of those things, it absolutely makes sense to go and get adjusted by a chiropractor who specializes in pregnancy and make sure your body is functioning properly. If that was the only problem that was present, then a lot of those symptoms may very well go away. But If that wasn't the only problem that is present, at least now you know, okay, everything's functioning probably from a neurological and mechanical standpoint. Now you can escalate it and go, well, what else could be going on that may need even more serious intervention or anything like that? Now, not every mother wants to have intervention-free childbirth, but no mother wants to have multiple interventions. So the better your body is functioning during pregnancy and leading up to childbirth, the less likely you are to need more and more interventions. So the Webster Technique is a very valuable tool that we use. We think that every pregnant mother should be checked and assessed, and if needed, adjusted by a chiropractor, especially ones that are certified in the Webster Technique. It is a very important tool that needs to be used. Not every chiropractor uses it and uses it correctly. So if you are currently looking for a chiropractor who utilizes the Webster Technique, you can go to sapicaro.com. We'd be more than happy to meet you and see if you're dealing with something that we might be able to help you with. Until then, thanks for your attention. We'll see you next time.